Is Delta driving most of these breakthrough cases you've studied?
Absolutely, and thanks for having me, Shepard. Delta is driving this. We know that the Delta variant has a higher viral load. It's more infectious, it's more contagious, and it is driving cases in the community. There's an extremely high viral burden in the community, but it's important to remember that the vaccines do work to prevent severe illness. And by and large, they also work to prevent breakthrough infections. So we have to remember that we have a largely unvaccinated population still that is very vulnerable, and that breakthrough cases make up a very low percentage overall of the total population that's been vaccinated that test positive.
What's your research shown about how vaccinated COVID patients recover compared to ones who are unvaccinated?
Yeah, it's a great question. And I think the key message there that we can take from sports is that if you're vaccinated and you do test positive, you come back sooner than if you had been unvaccinated. So individuals who are unvaccinated take several weeks potentially to come back to sports. And there's a much higher risk of Longcovid and a much higher risk of other complications associated with COVID than if you're vaccinated. So the athletes that...
I didn't mean to interrupt. Please go ahead.
No, the athletes that have gotten COVID, despite being vaccinated, by and large have returned and have done well and been able to return and perform at a high level.
What about long COVID symptoms? Are young athletes experiencing those as well?
That's an area of interest and an area that we have to continue to examine. If we look at the article that came out yesterday in the New England Journal looking at healthcare workers in Israel, there was a population, about 19% of individuals who developed long COVID symptoms despite having vaccination with the Pfizer vaccine. That's something that we have to continue to look at and really understand who develops long COVID and what are the characteristics.
I'm vaccinated. If I'm not wearing a mask, can I spread it to others, as the government's been telling us now? Do you have research on that?
Yeah, and I think this is another area of ongoing research that sports is providing, among other data sets. It's providing a really unique data set because we've been testing athletes for the better part of the last 18 months. And we're trying to use that framework to provide information back to broader society. That's why we started the group that we did. And that's why we've been collaborating with all of the sports leagues to provide insight to the CDC and to other organizations and other public health groups. And there is increasing evidence to suggest that you can spread it if you do have a breakthrough infection. But these are by and large the small number of cases that are in the community. We are seeing more spread due to unvaccinated individuals than we are seeing due to breakthrough infection. And that's why it's important for us to protect our most vulnerable population, which right now is the unvaccinated population.
Makes sense. I'd love to go to a concert. These crowds in Chicago at Lollapalooza, shoulder to shoulder, mosh pit style, everybody next to each other. Is this dangerous these days or no?
I think that anytime you're in large crowds, you should look at yourself and ask yourself what your risk exposure is. And are you comfortable in that situation? Personally, I don't feel comfortable going into large crowds, and I continue to wear a mask, and it's a personal choice. And I think that we want to be able to protect our vulnerable populations. We're getting into schools, we're getting into scenarios where we're going to have college football and tailgates. And what we want to do is protect our weakest population. And that's where I commend the CDC for not just changing their mask guidance, but really trying to optimize the recommendations for the populations where, like in schools, most of the population is unvaccinated. So protecting our teachers, protecting students who are unvaccinated really is the right public health measure. And it probably is going to lead to fewer flu cases this fall as well, like last year.
Hope so. Dr. Robby Sikka, thank you so much. Shepard Smith here. Thanks for watching CNBC on YouTube.